Hello everyone, my name is Ashley Oliver and today I will be talking about migraines as my health topic. Why are migraines an issue? Migraines can interfere with everyday life and a lot of people see them as just headaches when there's much more to them than that. They can prevent people from driving, working, exercising, or doing a number of other everyday tasks that normal people would find simple. The point is that they're disruptive, and a lot of people don't know that. Um, there are over 3 million cases per year of migraines in the U.S. alone. Uh, Migraines defined as a very intense headache that has a variety of symptoms and side effects depending on what type of migraine you have. There are two types of migraine, aura and with aura and without aura. With aura just means that you do have side effects before. There's numbness, you go maybe lose your vision in one eye or both eyes, peripheral vision for a short amount of time. You maybe cannot speak or your hearing's off. And without aura, it's just the headache itself. It comes on all at once. There's no pre-warning. Um, and I, for one, actually, I have retinal migraines, which are with aura. So I'll lose my vision in both eye, peripheral vision in both eyes, and I'll get numbness. And sometimes before I got treated for it, I would lose the ability to speak in a correct way. It was very odd, um, but it's a very disruptive disorder, I would say, more than a disease. As far as treatments go, there are a lot of treatments. There's a lot of medications. They're very tricky because you have to find, first of all, the right medication because there's a lot of side effects. There's your typical side effects, dizziness, dehydration, but these are some very harsh medications because they alter your chemical balance. So you're looking at weight loss, a lot of depression issues, anxiety, and a lot of medications that I spoke with my doctor on was caused uneven heartbeat. And they use a lot of alternative medications to treat migraines, such as seizure medication, which is what I take. I don't have seizures, but it expands my chemical balance enough to where once I'm getting an attack, it will kind of let my body relax, and it just kind of takes the brunt. Um, the point of this is that people have migraines every day, and they are sometimes seen as just, a headache. Why can't that person work? Well, these are limiting diseases where people can't see to drive. And if they experience one very suddenly, it could be a danger to their life or others. If they're driving down the road and they all of a sudden lose vision, or maybe imagine a teacher teaching in a class and they lose the ability to speak, or forbid an environment where it's even more dangerous, like construction or the military. Um, as far as to elaborate on prevention and behavior change, a lot of migraines are caused by allergens. So watching what you eat. Of course, there's always allergy medicine, but mainly a big thing is watching what you eat and seeing it, doing food journals and seeing if there's anything that irritates them or sparks them up. Another thing is lack of sleep. Making sure you're getting a decent amount of sleep. At least, everybody has their own requirements, but a good amount to what your body can function on. And the main thing besides allergens is stress. Stress is a huge cause for migraines because it releases it actually can change the dilation of your blood vessels, and it causes a shock in chemicals to your body. But you can actually get treatment for all those things, naturally. And then there's some people like me that it's really not stress. I just get migraines. I don't know why, and neither does my neurologist, but I take medicine for it every day, and it works. And I think that's why migraines as a whole goes very understood, because there's so many different cases, and it's hard to understand, why this person, can't see when they're having a migraine, or, why can't you come to work because you have a migraine, or, it's a hard health concept to understand unless you're going through it or you've witnessed it firsthand. But it is very treatable. So I hope you